Has your doctor ever made you feel like your symptoms were all in your head or tried to rush you out the door? Today, we're going to change that. I'm going to give you 5 tips to help you communicate with your doctor effectively and make sure that he's respecting you and what to do if he doesn't. Join me. It's good to see you. I'd like to share a really quick story with you. About 16 years ago, right after my husband and I got married, we got pregnant. Now, this was not my first baby, or my second, or even my third. This was my 4th baby. I was 30 years old. I had been through this process before. So when I went to my OB, who had never delivered any of my babies before, and told him that I wasn't feeling right, there was something wrong, he didn't listen to me. He fluffed me off. He told me everything's fine, you're fine. It's fine. Don't worry about it. There's nothing wrong. And he told me this for 2 months. After I told him, I know there's something going wrong. There's something not right. And I couldn't be specific because it was a pregnancy and I didn't know exactly what was happening. I just knew something wasn't right. But he didn't take me seriously. I ended up one night going to the ER. They took me in to do an ultrasound, and the ultrasound technician got very quiet and suddenly walked out of the room, and another one came in, and they said, there's something very seriously wrong and we have to transfer you immediately to another hospital that specializes in pregnancy and intervention. I was terrified. They put me in an ambulance and sent me to another town over an hour away. And when I got there, the doctors were reasonably well freaked out. They did amniocentesis, they did all these tests, and then they came and told me there's something wrong with the baby. And we need to try these we need to try these procedures to see if we can save the baby. And they went through and they did the procedures. And unfortunately, while we were in there and had gone through these procedures, while I was awake, freaked out, but they couldn't put me to sleep because they needed me awake for this, they did an intrautero blood transfusion for my baby. And they came back and said, I'm so sorry. You know, the transfusion worked and everything, but your baby was just too far gone and we're not going to be able to save her. So in the next few hours, her heart is going to stop and we're going to lose her. And the next day, my daughter was born stillborn. This was the first year of my husband and I's marriage. It was extremely traumatic. And I found out before I went home from the hospital that if the doctor had listened to me when I first said something to him and gotten me help, they could have saved her. They could have saved my baby. They could have done the procedures weeks earlier and she could have been saved. But they didn't because he didn't listen. This is the kind of not listening that is so detrimental that there is loss of life. My husband and I lost a child because a doctor didn't listen to me, didn't take me seriously. I don't want that to happen to you. So let's get into these 5 tips to help you be a better communicator and have your doctor respect you. For almost 3 decades, I have dealt with the medical profession, seen hundreds of doctors, and gone through this process. I have felt overlooked, not taken seriously. I have felt like I have been gaslit and pandered to. So much so that I finally got diagnosed with medical PTSD. because doctors actually do this to you. They make you feel inferior. They make you feel like you don't know what you're talking about, like they know your body better than you do, like they're not listening to you, they're trying to rush you out the door, or they will give you something like a diagnosis of anxiety and go lose weight when you really do have something actually wrong with you. Now, there are times where anxiety could be the problem, or panic attacks, but that's a totally different discussion. If you know there's something wrong with you and it's not anxiety, you have to know how to fight for your rights, how to advocate for yourself. So we're going to go through these 5 tips, and if you stay to the end, there is a bonus on what to do if none of this works. Tip number 1 is to be prepared. When you get ready to go to your appointment, whether it's a brand new doctor or a doctor you've seen dozens of times, make sure that you are prepared. Make a set of notes, a set of questions, and put them in order. Your top 3 questions should be listed 1, 2, 3. The 3 things you want to cover in this appointment, starting in order of importance. This is vital. It makes sure the doctor knows that you are prepared and that you are serious about this discussion. Also, part of being prepared is to make sure that when you go in there, you're not presenting yourself as somebody that is unprofessional, doesn't know what they want, doesn't know what they're doing. Make sure that you are clean, washed, presentable, you're wearing nice clothes, something professional, or dress casual at least. You're not going in there in sweatpants, sweatshirt, gym clothes, looking like you just rolled out of bed. It doesn't matter what you're feeling like. You need to look like you want to be taken seriously. This is part of being prepared. Also, be prepared to show them whatever is necessary in this appointment. So if it's some kind of injury or illness, make sure they can get to it easily and that you're prepared to show it to them. Be prepared. That is your first and most important tip. That leads directly into tip number 2. You need to communicate effectively. You need to know what you're talking about, what you want to know from the doctor, so that when they ask you questions, you can give them clear, concise answers. Be specific. In your notes, write down all of your symptoms, everything that's been bothering you, even if it seems insignificant, because it might tie in. It might just be that one little insignificant seeming detail that can give him a clue as to the whole picture and tie it together. So make sure you have your notes written down. Make sure that you are absolutely clear on what you want him to know, or her, and that you are communicating with them effectively, which means sit down, look them in the eye, make sure they are looking at you when you're speaking to them. Lean forward, keep eye contact, maintain good posture, speak clearly, communicate effectively. Tip number 3 is to ask the right questions. Make sure you know what questions you want answers to. What kind of medication do I need to be taking? When do I need to be taking it? Is there something else I need to be doing? Is there something I have done wrong? Make sure you know your important questions for each of your points. Communicate effectively. Ask the right questions. Be prepared. Those are your first 3 tips. Tip number 4 is a non-negotiable for me. If you're anything like me and have had memory issues in the past, or don't remember always everything you've done to tell the doctor, make sure you bring an advocate. Have a witness. Have someone there that can speak up for you if the doctor's not paying attention, not treating you right, or you're forgetting details. Make sure you have a witness so that you can have an advocate for your needs during this appointment. Like I said, for me, this is a non-negotiable. I learned this the hard way. And that leads into our final tip, tip number 5. After you have remembered your advocate and you have been prepared and you've asked the right questions and you've communicated effectively, now you need to make sure that you have documented this process. Ask the doctor to see the notes. While you are sitting there, you need to know what they have written into your chart, what they're going to write into your chart. I have had the experience where the doctor has seemed to communicate effectively with me, seemed to listen to me, and I've gone back into my portal later and checked their notes for the visit. And instead of hearing what I had to say, they put something totally and completely different in there. I had one doctor, one time, write in my notes that I seemed to have a drinking problem after they asked me if I had any wine. And I said, yes, I had a glass of wine. A glass. And they put in my chart that I had a drinking problem. You have no idea the hassle, the time, and the trouble it took me to get that taken off of my medical record. Because once they label you as having anxiety, having some kind of drinking problem, having some kind of addiction, having anything that they can fluff you off with, that's going to follow you for the rest of your medical. It will be in your charts. It will be on your record. Make sure you know what they're putting in your notes, and then request a hard copy of it. If you have imaging done, make sure you get it on disc. With the notes, make sure you get a copy of their notes. This is going to cover you if you have to go back and fight with them over something they put in there erroneously. It takes so much to get something taken off your notes. But making sure that you are covered beforehand saves that time, that trouble, and sometimes that legal expense. And truly, it can get ugly because they don't want to go back and adjust your notes. They'll tell you it's impossible. Make sure you know what they're putting down in your notes. And that leads into our final bonus tip. If your doctor is not communicating effectively, if they're not looking you in the eye when they're speaking to you, if they're not writing down accurate things in your charts, if they're not doing what you need them to do for you, and they're trying to fluff you off and tell you there's nothing wrong with you, or you just have anxiety and you need to lose weight, believe me, I heard that for more than 20 years. You can fire them. Your doctor doesn't know everything. Your doctor works for you. You are the boss, not the doctor. If they're not listening to you, if they're not respecting you, if they're not taking you seriously, if they're not helping you, fire them. Get up, walk out, and find another doctor. That is your right. All these HIPAA rights that nobody tends to read, that's in there. They can't sell your information. They have to help you. It's part of the Hippocratic Oath. They can't intentionally do something to harm you, and they have to do everything in their power to help you. If they are not doing their job. It doesn't matter whether you like them or not. If they're not an effective doctor, fire them. You're the boss, not them. You have lived in your body your whole life. They haven't. You know your body better than they do. It is your responsibility to have an advocate, to be prepared, to take notes, to get notes, It's their responsibility to listen and to help you. That's how you effectively navigate this system. Make sure you have these 5 tips on board. And remember, if you're not getting the help you need, find someone that will give you the help you need. I hope this video helped you. If it did, please leave me a like, subscribe. If you have any questions or comments, if anything like this has happened to you in the past and you've had to use some of these tips, leave me a comment down below. I'd love to have a conversation with you about it. Like I said, I've been dealing with this for more than 2 decades, almost 3 now. I have been overlooked, I have been minimized, I have been gaslit. I have had to go back and deal with legal issues over this. I have had 3 unnecessary surgeries. I have been told that I needed to go see a therapist and lose weight after 20 plus years of looking for a diagnosis for something that took the right doctor 5 minutes. Doctors will tell you that in medical school, they are trained to look for horses when they hear hoofbeats and not zebras. There are a lot of us zebras out here. A lot of us that don't fit into the mold, that will have our labs come back normal and our scans come back normal or mostly normal. And doctors will say, oh, I can't find anything wrong with you. So you must be a hypochondriac. You must have anxiety. Maybe it's your weight. If you don't fit the exact standard profile, it's got to be your weight. Go lose weight. I actually had most of my stomach removed. Weight loss surgery. Lost over 100 pounds. And for another 5 years, they told me, you're overweight, go lose weight. I couldn't. I was stuck. It wasn't my weight. It was never actually my weight. My weight was a factor of what was wrong with me. And the fact that I couldn't lose weight without surgery was part of it as well. When I finally got diagnosed, I got told I have a genetic condition that's incurable, degenerative, and there's very little treatment for it. And guess what? Most doctors don't know anything about it. They've had maybe 5-10 minutes worth of information about it in school. 90% of the doctors that I've seen, I am more knowledgeable about my condition than they are. So make sure you do your homework. Advocate for yourself. Be prepared. Good luck. Hi, one more time, Editing Rachel here. I wanted to share with you some very exciting news I have. I have published several books on Amazon, and I wanted to share them with you. The first one is called Activate Your Ascent, a leveling up system. This book is designed to help you unleash your true potential, to break free from old habits and curate the life that you want. It comes with a workbook, gives you questions, goal setting, actionable tips and tricks. The second book is The Art of Elevated Presentation. This is more than just style tips. This includes manners, etiquette, self-care, grooming, the whole enchilada. This one also comes with a workbook to help you really nail down your presentation. And finally, I have the Elevated Wardrobe. This is more than just wardrobe advice. This is a booklet on how to help you organize your wardrobe, tips and tricks on styling your wardrobe, setting it up to help you level up your week, choose your outfits, find your clothes, and how to take care of them properly. If these sound like something you might be interested in, please check them out. I will leave a link in the description box below, and if I don't manage that because this is all new to me, I will leave links in a pinned comment. Thank you so much for watching today. Have a great rest of your week. and I hope to see you soon.